Hi, Joan. Let's talk about ticks today.
Okay.
So, could you tell us a little bit about tick season now that it's upon us, and what we can do to prevent uh, tick-borne illnesses like Lyme?
Okay, Jen. So ticks are actually out most often at this time of year, and it's the nymphs that are out right now. So they're the smallest form that bite us, and so this is the time that people actually are most commonly affected by Lyme and other tick-borne illnesses. Ticks actually can be active though anytime it's above 4 degrees. So anytime it's above 4 degrees, you want to be aware that you could get bitten by a tick.
So, how can we prevent being bitten by a tick, or what can we do to prevent illness?
Right, right. So I guess just to be aware about ticks. So ticks live near the ground. They need to be near humidity, but when they want to attach to get a blood meal, they come out of the foliage and they quest. So anything that brushes by them, they just climb aboard. So one of the things you want to do if you're outside, stay on the path. Keep your pets on the path when you're outside. Wear an insect repellent that repels ticks. So follow the instructions that for tick prevention. And in Canada, those products are DEET and Keratin. We also are starting to see permethrin treated clothing on the market. So that's another way that you can prevent ticks. Around your house, you can create a tick-free zone by keeping things manicured so that there's less humidity. Get rid of leaf litter, things like that. You can use pet prevention for your pets, tick prevention for your pets. So that's another way. And then when you come inside, so check for everything around you when you come inside. So check your shoes, check your clothes, check your kids, check yourself, and then you can also put clothes in the dryer for 15 minutes when you come in. If they're wet already, dry them, and then add 15 minutes on high heat. Those are things that you can do when you come inside.
Okay, and can you clarify some myths, or if they are myths? Do ticks fall from a tree? Should we be protecting our scalp?
So ticks, nope, they don't fall from trees. So they don't fly, they don't fall from trees. They really do need about 80% humidity. So we're talking about the black-legged tick here.
Okay.
Black-legged tick is the tick in our area that carries diseases. And so they need high humidity. They need to be near the ground. They come up. They go. They attack. They sit on like a stem.
Yeah.
And then they climb onto us from there. So then when they dry out a bit, they go back down. They get moist again, and they come back out. So that's how they attach to us.
Okay.
So really, we're getting them from up to maybe knee level or so. Mm-hmm.
So what should I do if I see a tick on me and it's already in my skin?
Right. So once you see a tick that's attached, you want to remove it promptly. So when you see it, remove it. You use fine-tipped tweezers. You want to get as close to the skin as possible, and you just pull up nice, slowly, steadily to remove that tick. And then if you do see like a couple of black spots, some mouthpiece left behind, don't worry about that. It is really just the mouth parts. So the tick doesn't burrow, its head doesn't go inside. It is just the mouth parts. So they won't transmit disease. You can just leave them, clean the skin. And then what you do over the next 24 to 48 hours, you might see redness. You want to just watch that site, but that redness should go away over the next 24 to 48 hours. That's just from the bug bite. But then for the next month, 3 to 30 days after the tick bite, you're monitoring for signs of early tick-borne illness. So fever, achiness, extreme fatigue, severe headache, neck ache, and an expanding rash at the site of the bite. That's what you're looking for. And that rash, we used to say, look for a bullseye rash. We don't say that at all anymore. It might look like a bullseye rash, but more often it'll just be an expanding rash. And we don't even say look for an expanding red rash anymore, because if it's below the waist, it might look more like a bruise. If you have dark skin, it's not going to be red. So you're just looking for an expanding rash, expands over several days, gets bigger than 5 centimeters across generally. That's what you're looking for.
Okay.
That's the Lyme disease rash.
Okay, thanks. So I hear that there is a new tick-borne illness in our region, and it's called anaplasmosis. What can you tell us about anaplasmosis and the difference between that and, say, Lyme?
Right. So anaplasmosis is another bacteria that the black-legged tick can carry, and we're starting to see that here. We would call it an emerging tick-borne infection. And the good news is that it is treated with doxycycline. So it's the same antibiotic that is treated Lyme, that we treat Lyme disease with.
Okay.
It has some of the same similar symptoms. So 5 to 14 days after a tick bite, a person might start with some of those same symptoms. It doesn't have a rash usually. And unlike Lyme disease, it's a little different because if you are young, if you're healthy, you have no problems with your immune system, you might just have a mild illness or never know you had it, and it goes away without treatment. But if you're older, if you have problems with your immune system and you start to have symptoms and it's not recognized, or if you have delayed treatment, then it can get more severe and it can be a severe illness. So what we need to do is, if we've been in tick habitat, we know we've had a tick bite, then if we have signs and symptoms, you need to see your healthcare provider and see whether you need to be treated for a tick-borne illness.
If we do find a tick, do we take this tick as a sample to public health to be looked at, or does that exist anymore?
It doesn't exist anymore now that we know that our area is endemic for Lyme, which means that more than 20% of our ticks are positive for Lyme disease infection. The lab doesn't accept our ticks anymore, and really actually no health units in Ontario can submit their ticks to the National Microbiology Lab anymore because we have black-legged ticks and they carry the bacteria that causes Lyme disease. So now all health units go out and drag for ticks. We drag a flannel behind us and we collect the ticks. So we do that every spring and every fall. We send those ticks in and they're analyzed for tick-borne illness. So we don't accept ticks anymore. We do have, if people are wondering what kind of tick it is, there is a website called etick.ca. You can take a photo of your tick and upload it to the site, and you'll get an answer about what kind of tick it is, as well as usually an indication of whether or not it's been, whether it's partially fed, whether it's engorged, or whether it hasn't been feeding for very long. So that's something that people can do.
Are there any other tips that you can give us to prevent ticks and tick-borne illness?
So one of the things we haven't talked about yet, one of the things that's really important, is that at least once a day when you've been outside in our area in tick habitat, that you do a daily tick check. So one thing ticks do is generally they do come aboard at a lower level and then they climb upwards. Often they stop then at a spot where there's clothing that stops them, or like the back of the knee or the crook of the elbow, maybe the belt, something like that, and then that's where they'll attach. So you have to look back, front, all areas of your body, and doing that once in every 24 hours is a great thing to do, something that we really want everybody to do in our area when they've been outdoors. And then as well, some of the other things you can do, especially if you're an outdoor worker, if you're wearing long pants, tuck your pants into your socks, wear long sleeves, tuck your shirt into your pants. That gives you, more time to see a tick and to brush it off. Wearing lighter clothes so that you can see a tick. When you come indoors, if you could have a shower so that you brush off ticks that haven't attached yet, or also gives you time to check for ticks. And in our area, if you have had a tick that is a black-legged tick and it's been attached for longer than 24 hours and it's within 72 hours of removal, you can see your healthcare provider and talk about taking a single dose of the antibiotic doxycycline to prevent Lyme disease. You still monitor for symptoms of Lyme disease and other tick-borne illnesses, early tick-borne illness for 3 to 30 days, the next 3 to 30 days, because it's not 100% and there are other emerging infections. So you still want to do that, but that's something that we can do in our area because we are endemic for Lyme disease.
And should parents be checking their children when they come in as well?
Absolutely,
okay.
Absolutely.
Just making sure.
Kids are really susceptible to Lyme disease. They're the ones that are out rolling in the grass and So they're at the level of our ticks. So we want to absolutely check our children when they come inside, and do a daily tick check.
Okay, and for more information about this, where can people find prevention tips?
You can go to the website, which is kflaph.ca/Lyme.
Okay, thanks very much, Joan.
Okay.
Thanks.